Hello, hi. My name is Erica and I'm your nurse today.
Awesome.
Okay, great. So while I do my hand hygiene, let me briefly just describe what we're going to be doing here today. What we're supposed to be doing is a head to toe assessment, like your well checkup, and we're just going to be doing some assessments, okay? Does that sound good to you?
That sounds amazing.
Great, okay. So my name is Erica and I'm your nurse, and you are, just to make sure that we have the right person, will you tell me your name and date of birth?
Matthew Morris, 5/15/83.
Excellent, very good. Okay. Mr. Morris, let's see. First of all, I wanted to get started by reviewing the vital signs the tech gave me from before you came back. And we'll just go over those really quick. Oh, yeah, you can hop on the scale real quick. We'll go ahead and get your weight. Get your weight and height. Okay. Let's see, the tech did tell us that your vital signs were temperature 98.7 degrees Fahrenheit, pulse 88, blood pressure 125/80, and respiration 17, and SpO2, which is your oxygen saturation, was 100% on room air. All of those sound good and are within normal limits for an adult. Okay, excellent. Your weight looks good. We don't have to say that out loud unless you just want to. I'll put it in the notes for the chart. It looks good to me, though. All right. 214.7. Good job. Better than it was last time, right?
Mm-hmm.
All right. Very good. So let's see. Oh, have you been experiencing any pain? Like now? Are you in pain now?
I hurt all the time. So, I haven't been experiencing any new pain.
New pain. Okay. Well, when you say you hurt all of the time, does that mean consistently, continuously?
No, just my muscles.
Just your muscles?
Because I work.
Okay. So, when they continuously hurt, are they normally, if you have a scale of 0 to 10, 0 being no pain, 10 being the worst possible pain imaginable, on that scale, what would you rate your muscle soreness on a daily basis?
I don't know, probably like a 2 or 3 or 4.
Like a 2 or 3 or 4?
Probably like in the mornings, like a 2.
Okay. When you first get up?
Yeah. Oh, no, wait a minute. No, when I first get up, my neck is like a 7. And then it goes away, and then, and then just probably like a 2. And then towards the end of the day, maybe like a 4. And then I go to sleep and it just starts over again.
This is just the neck, right?
Just because my pillow. I need a new pillow. So you can't get those on prescription or nothing?
No, but I can try to find some recommendations for
All right, cool.
Okay.
Yeah.
There's some good pillows. We'll go ahead and assess your neck while we're at it. How about that?
Yeah, and
see if I feel
if you
anything.
can find one with the feathers in it.
Okay.
All right.
Okay. That sounds good.
Because I always wanted one.
Okay. I don't know if we keep them in stock here, but also we'll see what we can do.
See if anybody has, any of your friends have one that they want to tell me it works.
Okay.
Thank you.
Okay. That sounds good. We'll get something figured out, and yeah. So let's see. Also, while we're at it, do you know? These are just questions that we ask everybody that come in, if they know. And so don't be offended. These are just basic standard questions. Do you know where we currently are?
In the doctor's office.
Very good. And do you know what day it is?
Friday.
Excellent. Do you know the year?
2024.
Very good. And you know the current situation, what we're doing here today?
Yeah, we were, just supposed to be going over all my numbers and stuff, and then you said you was gonna help me find a good pillow, so we added that to the list.
Okay.
But yeah, you're just gonna tell me
they're-
my numbers.
Which numbers are we talking
I don't know.
about
Whatever y'all
specific?
checked on me last time.
Oh, your lab work.
Yeah.
Okay,
Whatever.
okay. Yeah, we normally they call and you can log into your My Chart, but I can help you with that.
You know,
after the assessment.
I just got a flip phone, so I don't know. You know, I can't do all that fancy stuff.
I understand. That's no problem. Okay, but we're also here for the well checkup and the head to toe assessment.
Yeah.
Yes, that too. Okay, cool.
That.
I'm going to go ahead and say that you're definitely alert. You're oriented to the time, the day, the place, situation. Yeah, I'll give you that too. And
Sometimes in the mornings, you know, I like to drink the green tea and stuff,
yeah.
and it helps me be alert.
Oh, okay.
So I drank some already.
Okay, good.
That's probably
great.
why. I didn't know if anyone could tell, but.
Oh, okay.
Because I had 2 cups.
Oh, gosh. Okay.
Yeah, I'm feeling a little, you know.
Oh, I see.
Because of the tea.
Yeah, we definitely might need to do a med rec, and what that just means is that we like to look over your medications and make sure there's no interactions. I see your list is quite extensive here,
Yes.
so I'll definitely
Yeah.
have to go over that. Do you take
It's
any
like a
herbal
CVS
teas?
receipt.
Do you take any of those herbal teas, like you don't have any ginkgo biloba in them?
Not the ones I'm drinking now.
Okay, good. Because those can interact with things, and ginger root can interact with like bleeding. You can.
It may have that.
Well, possibly the next time you're at home, you could send us a little picture of the ingredient list.
Oh, it's gonna be longer than my medication list.
Okay, well maybe
I'll send it.
maybe try to avoid those 2 at least, the ginkgo, the ginger. Okay, did I say ginger or did I say garlic?
No, you didn't say garlic.
Okay,
yet.
I meant to say garlic. That's
Oh,
when
garlic.
I think. Look, I tell you what, we'll go over all that in a bit
Okay.
because it can be a lot, but we'll look at it.
Yeah, it's just
All right.
making me thirsty for tea.
I'm
again.
sorry. I'll make us a note. We'll go over teas. Because of the herbals, you know, some of that can interact with med rec. I'm just making myself a note for later. Okay. And we'll access your chart for the labs. I always jot myself little notes so I don't lie to you and say I'll do something and then forget because I didn't write it down. How about that?
Hey, that's what I have to do.
Okay. So, let's see here. We're going to go ahead and I already did my hand hygiene. And I'm going to take a look at your scalp. You know, because we're going to start with the head.
Also, my allergies have been like really bad and stuff. So like, I don't know if you want to like maybe you could like feel my lymph nodes or something and see if they feel alright.
Okay. Well, I will do that. Have you been thinking you have cold-like symptoms? Let me check your sinuses too.
I had 2 days ago. I had them worse than I did. Yesterday I had them worse than I had today.
Did you get a flu shot, sir?
Yep.
Excellent. This year? Okay. How long ago was that? Couple weeks?
Like a month.
Good. It usually takes a couple weeks to get
Yeah, that's what they told me.
immunity.
They told me it didn't matter. Everyone else was sick in my house because it took 2 weeks, but
Yeah.
that was wrong, I guess. 'Cause
Was there any
I didn't
pain?
get sick.
That's good.
No, it didn't hurt there.
Good. No pain, tenderness, or pressure on the frontal or maxillary sinuses.
No, not
Good.
really. I mean, it was a little bit, you know, like a
this
little
one?
sore, like maybe, just a little bit. Maybe that's because my skin is chapped or something from the wind. Does it work outside?
Well, it's the skin on your face appears to be, you know, well hydrated, considering, you know, you work outside. Lips are a bit dry, but not chapped. They're still pink and adequately. And let's see, go ahead and say,
And then
I'm just
look, I
looking
got all
at-
these little sores and
Okay.
stuff, and they're like all in
Oh.
my mouth everywhere.
Is that a side effect of one of your medications?
Right.
Mhm. Okay, I think that is a common side effect of one of the medications on your prescription list. And so I'm glad you let us know. We'll get the physician to see if there's some medication to help with that. Unfortunately, it's one of the risks versus benefits. So your head is normal cephalic in shape. The hair distribution, you have pretty thick hair. It's dark brown in color with a few salt and pepper grays, just very few, not many. Let me look at the back side, okay? Very good. It's evenly distributed and appears to be clean, kind of shiny. It's kind of wavy, thick. And then the facial hair, which is like a full beard, it's a little bit more coarse and curly than the head on the hair. A bit dry, maybe from the wind, but it's definitely grown in and full, evenly dispersed all throughout. Okay, it's clean. There's no nits or any lesions or bumps or lumps.
No, I had the bump cut off like a couple years ago.
Okay.
It was a mole.
Uh-huh.
Every time I get my hair cut, they would hit it with the comb. It really wouldn't bother me, but it would scare them. So I just got used to it, and I just showed them every time before they started cutting my hair.
Okay.
Also, I used to wear my hair like this, like on Sundays I would put it up, but my hairline I think is going up, so I stopped doing that. So I just been doing this because it makes my hairline look, you know. I just want to next time you check a year from now at my appointment,
if it's receding,
you'll know.
Oh, I
That's
see.
what I'm saying. Yeah.
Okay, I understand.
You'll be able to tell.
Okay. Well, maybe not. You never do know about those things. Okay. Let me see here. Okay. So I checked your hair distribution. Good. Your eyes are symmetrical in line with one another on your face, and your ears as well. They're not too high. They're not too low. They're exactly where they're supposed to be in proportion with your eyes. Nose is in the middle of the eyes as it should be, normal placement. Let's see, speaking of the nose, I'm going to ask you to tilt your head back so I can take a glance in there with my pen light. Okay, and okay, there's no septal deviation in there. It appears to be no obstructions on either side. I'm going to ask you to cover one side of your nose, one nostril. There you go, breathe in. Excellent. And then do the same with the other side for me. Very good. Okay. No problems or occlusions getting any air in. I could hear it going in and
Just
out.
from this little stopped up from the
Right. Normal
like I was
allergens.
telling you about.
Good. Okay, so it appears that both nares are patent and there's no obstructions in either one, which is good. That's what we were looking for. So speaking of no obstructions, I'm going to look in your ear. Just going to check for any wax buildup or any, make sure there's no foreign bodies in there. And if I were using the otoscope, the one that's specially for the ears, I would be able to see a nice shiny little eardrum that looks like a little snail down in there if I was looking for a normal healthy eardrum. But today we're just checking, make sure there's no foreign bodies, excess hair, or too much wax. I see a small amount of cerumen, which is earwax. That's good and normal. No problems with that. Okay, I don't see any lesions or scars on the ears. Do you have any hearing problems? You do not. In your chart, you don't.
No, I'm just, sometimes it's hard.
Because you work outside and around loud tractors.
Yeah.
Like normal kind of.
I mean, I went to the ear doctor
Okay.
and they did all those tests, but I feel like when no one's talking, like I can hear really well. And nobody was talking when I did the test, so I don't know if it's,
Okay. Okay, well, I can refer you to a really good ENT for now for the assessment purposes. What I'm going to do is I'm just going to whisper a word on each side. Since you did say yes to that question, I'm going to further assess.
Okay. Yeah, I mean, hey, better safe than sorry, right?
Uh-huh. Okay.
Yeah.
You ready? I'm going to say it quietly, so you might want to listen carefully, okay?
Too easy. Pink. You gotta give me like a 3-syllable word or something.
Oh, okay.
No, it's 4 syllables. American?
American, that's
Okay.
it. Okay. We'll do a 2-syllable word over here. How about
oranges.
Very good. Okay. Well, you're able to hear well enough to continue with the assessment, but we'll still check it out further at a later time. Okay. So we've checked the ears for any foreign bodies and or anything. Nothing like that. There's no drainage or anything. I'm gonna go ahead and check the eyes just for drainage. Could you look at me for a moment? I'm just looking at your sclera. Okay, I'm looking at your sclera. It's clear and shiny as it should be, okay? The conjunctival sac, I'm gonna be real general, it's okay. I'm just making sure that it's good, that I don't see any signs of infection, and I don't. There's no extra drainage coming out of the eyes at all, okay? I don't see.
Not this year.
Not this year, okay, good. So if you would not mind, I'm gonna dim the light for just a moment and check something.
That's probably in my chart though from the year that it was because I got poked with the Christmas tree.
Okay. Okay. Yeah.
That was bad.
It does sound rough.
Yeah, it was really, really rough.
I'm gonna let your eyes adjust and. Wow, okay. I'm gonna pull the pen light beside, and what I'm checking for is that the pupils restrict to light, and they did.
They feel like they did.
They're about a 3 now, and I'm pulling them to the side, and they get to about a 2. So they are equal on both sides. They restrict. They're both round, equal, reactive to light, and accommodative. Okay, they went from a bilateral 3 millimeter to a bilateral 2 millimeter. Okay, real quick, you could follow this pen light for me. Okay, and just making sure that your eyes are both able to go simultaneously through the extraocular movements as you follow them in the cardinal directions of the pen light. Okay, good. Now you could kind of relax them and let them go back to your normal state as I turn you can close them while I turn the light on if you need time to adjust. Okay.
Got it.
Very, very good. The next thing that I'm going to do, since we're on the face, we're going to go ahead and check the inside of the mouth, okay? So if you don't mind, just say, ah. Okay, good.
See all those sores.
Yeah, but I'm looking for making sure that all of your teeth are present. Good. They're all natural teeth are present. The uvula is midline. The tonsils are present, about a +2 in size on both sides. No excess or malodorous or extra green or yellow drainage or anything in the back of the throat, which is
It's
good.
not
I don't
because
see
I
any,
had it.
just some clear and little clearish white drainage. I do note in the
that
back.
2 days ago thing I was telling you
But
about.
I don't see
with the
any.
allergies.
It's not yellow or green, so that's a good thing.
Good, because I was coughing all kind of stuff.
Yeah, just your kind of clear to slightly milky color, but that's about
That's just that regular
drainage
right?
from the normal sinus drainage,
Yeah.
I'm sure. So it doesn't look to me to be infected. You still have your tonsils, right?
Yeah, still got them.
Both of them. I have mine too, so it's okay. Some of us do. And they don't appear to be red or inflamed, so that's a good thing. I'm going to go ahead and feel right here as you swallow for me. Just swallow regularly. Good. Okay. It appears the trachea is midline. Okay. The equal rise of the and fall of the chest when you breathe. Good skin turgor here on the chest, the neck. Good color. Let's see here. I'm just feeling for the temperature. It appears to be warm, but not hot. Okay, pink with rapid rebound on the turgor, okay? That just tells me that you're decently hydrated and you're not dehydrated. Feeling for your pulses on both of your hands to see if they're even or not. Okay. Alright, I'm checking my watch to watch the rate to see, to get your pulse rate on your radial pulses. $74, bilateral. Okay, could you grip my fingers for me? Good. Now let me push against him. And now you try to push up. Good. Now try to push back. Just like this.
Your back.
Like that. There.
Oh,
Good.
okay.
Yeah. Just
Forward.
make sure. Yeah. Forward. And can you do this and open and close? Finger, make a fist and open. Touch to each fingertip.
I mean, we can get about right there.
That's good enough, just so that you can kind of touch each fingertip. Good. Range of motion sensation. Close your eyes. Thank you. Now tell me where I'm tapping or touching. Where?
My left hand,
Good.
right hand,
Okay, great.
the forearm,
Very good.
the top of my ear.
Good. He's still closing?
Oh yeah,
Okay.
I wasn't
I'm
looking
going to check
anyway.
in real quick. Now your feet and your legs. Kind of pull this up. Just kind of take a look at that skin down here. I know all my patients think I'm weird and crazy, but I always go for their legs and feet. They're like,
No, that's
"Oh,
cool.
what are
My
you
last
doing?" You know?
doctor always did a little tickle test on my toes.
Okay. So you get
Because
it.
for my blood sugar.
Yeah. Feeling
Yeah.
the popliteal behind the knee, making sure you have a decent circulatory system all the way down here. So you have a history of diabetes type 2, is that correct?
Mm-hmm.
Okay, that's good to know. I don't see any sores on the shins or the legs. Hair's also evenly distributed. Now, I'm going to feel behind here, behind the ankle for the posterior tibial. And then the dorsalis pedis is on the top of the foot here, very top, the ventral surface. Actually, that's the dorsal surface. I'm sorry, it's the dorsal surface.
Yeah, I wasn't going to say nothing, but no, I'm just kidding. I didn't know.
Yeah, well, let me just compare them both sides. I'm going to feel both pulses to make sure one's not stronger than the other.
As long as you just say okay, I'm just good with it.
I'm going to rate them a +1 or a +2. If there was a 1.5, which there's not, I could do. I'm going to say a +2. They're strong, but not bounding.
I use them every day.
Okay. Yeah, and the skin, actually, there's no scaling or peeling. For
No.
a diabetic, the skin
No.
looks good to me.
I haven't had that.
Okay.
It's just sometimes my knees are a little sore.
Well,
You know, I think that's just
strong
from
reflex
before I
there,
got
okay.
on the meds that I'm on now. And my blood sugar was high for so long. I think it may have, you know, caused some damage and stuff.
Well, you said they did a sensation test.
Oh yeah,
so
they've
they-
already done it all now.
Okay.
Everything's fine, you know. So. Yeah.
Well, good. Okay, I gotta get back to it. I had to go ahead
Yeah, I
and
just
start
wanted you
and
to
go all
know.
the way down with with pulses. So
Okay.
That way I got them all my check boxes checked there. Okay. I get distracted if I don't get going in that same uniform there. But anyways, back to the face and the head and the neck. All right, because this is a very important thing. We didn't do it your last well check, but we do it every other time. So we're doing it this one.
I gotta get a shot.
Now.
don't
Huh?
I gotta get a shot.
No.
No.
No, you just gotta let me feel your lymph nodes. We're gonna start in the back of the head, right here at the near the occiput. Find the occipital bone, go right below it. And I'm feeling for any lymph nodes. If I can't find them, that's usually just a good thing. I don't want them to be too big or anything. And this feels good because I don't feel any sticking out. I'm gonna come around here behind your ear.
I don't think I ever had anything sticking out.
The
My back of my head.
No, that's a good thing. The pre and the post auricular, feeling for here. I can feel for this bilaterally on both sides, the pre and the post auricular.
That's where it was a little sore, you know.
Okay.
Probably because of all that drainage.
Oh yeah, it could be the ear, nose, and throat are all connected. I'm gonna come up under here and feel the submandibular lymph nodes and the submental. Okay, and then I'm gonna
You
go
could have just
down.
asked me if you want to feel my beard.
Okay, the tonsillar, which would be right in here. Can you feel that near the back of your tonsils? Where I'm pushing?
Oh
Okay,
yeah.
very good. Also would need to, sorry, I almost forgot my pen light. If I don't keep it in my pocket, I will.
Yeah.
So the There's a, down the sides would be like a deep cervical chain and a superficial one. One I would just feel a little deeper than the other. And it's a good thing, like I said, if I don't feel them. Or if they're just small. So then the supraclavicular, which let me find your collarbone.
Tickles.
Oh, sorry.
No, you're good.
I'm feeling kind of hard because I don't feel them, which that's a good thing. I'm just feeling above the collarbone. Okay, that's
Yeah,
good.
it just tickles.
That's okay. That's super. So they're not swollen. So obviously, or I'd feel them.
No,
Okay,
I haven't
good.
been feeling swollen, so
Very good. Very good.
yeah.
All right. The next thing that I need to make sure that I have checked on you, sir, is since we're doing hair, skin, and nails, let's knock that cap refill out. Let me see those fingernails.
Oh, I thought we were doing that a while ago. When I was...
Well, we did, but we didn't do the nails, so we have to do that. Just make sure that there's rapid rebound
Oh,
of
yeah.
circulation when we blanch the nail bed. I don't notice any clubbing or... Okay, and then on your toenail, I would check as well, so... You know.
Stand back.
We're
We're gonna put your mask
you can
on.
just
All
you're
right.
okay. Hey, I've seen it all, don't worry. Oh, those aren't...
Oh, it's
I was
not,
scared, they're not
it's
even
not,
bad.
It's not the look.
Oh, okay, don't worry. Alright, so I just was checking skin turgor as well.
It works.
Well, the Capri feels good, and the skin turgor looks good too. So, good for a diabetic. Those feet do not really look bad.
Some nice looking diabetic feet, ain't it?
Yes, sir. Thank you. Okay,
I was just
and
thinking so.
yes.
No,
Now,
I wasn't thinking that.
back.
Can I put my
so,
sock back on?
Yes, you can. Thank you.
Alright, cool. Alright.
Okay. Excellent. Now, oh, okay. Let me go ahead and write this one. Okay, very good. So, I'm going to need to go ahead and have you stand up because I'm going to need to check the S curvature of your spine and make sure that it just still is doing the way it's supposed to do at the spine.
Yeah.
And then I'm going to listen
Cool.
to your... Before I do that,
Used to
I
do this
want
in
to
elementary school.
Good. Before I do that, yeah, that's right. They sure
Mhm.
do. That's what they do. Let me go ahead and do the carotid pulse check before I do the spine. I'm just going to feel one side at a time for your carotid pulse. You don't ever want to feel both sides at the same time. Why? Because you need that circulation up there, remember? Yeah, okay.
Yeah,
mind.
no, I didn't know
It's okay.
if I would start talking, if it mess your thing up, and
Yeah.
listening. So, kind of like when you're at the dentist and they ask you questions, you're like,
Yeah, I get that. You just breathe normally for me. And then take one deep breath. Hold it and then. Perfect. Okay.
Again.
That's good.
Oh.
There's no bruise auscultated. I can, the pulses are strong on both the left and the right carotid arteries. Okay. And let's see, I'm just feeling for the spine. Checking make sure, just stand up straight for me. And the spine. Nice S curvature as it should be. And it feels straight.
Man, this is the best part of the whole test.
Okay, good. Now I'm just going to quickly assess the skin on your back. No scars. Good skin turgor. No lesions, lumps, bumps, one tattoo.
No, I went to the dermatologist a month ago.
A lot of moles, but
He checked them.
You go to the dermatologist frequently, at least once a year.
Once a year.
So that's good.
And the eye doctor once a year.
Good, very good. Okay, now this part, we're just going to be quiet, but breathe normally unless I say take a deep breath. And when I say deep breath, then breathe in deep through your nose, hold it for a couple seconds, and then exhale out of your mouth, and then you can resume back to normal breathing.
So wait.
So unless I say deep breath, then just breathe normally. Just don't forget to keep breathing, okay?
Okay.
I'm just going to listen to your lung sounds in a few spots across your back.
What should I do with my hands?
Side of your hands. You can have them rested at your side, or if it makes you more comfortable to belly breathe and put them on your belly like I teach the kids to do, you can do that as well. However you feel most relaxed and comfortable. And once I do this part, I'll let you sit back down. Okay, this part is just easier for my assessment video. Okay, so I'm gonna go ahead and get started and listen to some lung sounds, okay? Does that sound all right?
Mm-hmm.
All right. I'm going to also listen to 2 on each side, and I might slip those in at random spots, a minimum of 2. Now you can take a deep breath for me.
Oh, wait, I'm supposed to hold it?
Good. You can just resume back to normal breathing, because I'm going to be moving around to several different spots on the back as you breathe. Inside, deep breath. Good. Back. Deep breath. Good. Okay. I guess I'll just go ahead and come around and listen on the front while you're standing up, if that's okay. And also, it's a good opportunity for me to assess the skin and the hair distribution of your abdomen and thorax while I'm doing these assessments. I'm also always assessing the skin, noting if there is any significant or changes in coloration from one place to the other and side to side, okay? I'm going to begin listening to the anterior portion of the lungs and thorax, okay? Again, just breathe normal unless I say deep breath. But then you take one. So, deep breath. Deep breath. Hold it. Exhale through your mouth. Good.
Sorry, that was my nose.
Okay. All right, good. So, vesicular breath sounds. No adventitious breath sounds. No rails, crackles, bronchi, wheezes. Very clear breath sounds anterior, posteriorly, throughout all lung fields. Sound good. Okay? Excellent. So, you, actually, last thing, since you're standing up, let's go ahead and check out that abdomen. Okay. Have you had any abdominal issues lately? Any pain or anything? Any changes you need me to know about? Okay,
No,
good. Okay.
no.
Well, so I'm going to go ahead and teach you some organs that are on both sides of the body, just for educational purposes. On your left side of your body is your spleen. You ever been running or playing sports and then all of a sudden you got this big bad cramp right here in your side? That would be what your spleen contracting to release extra blood to the body
I thought it was
to
over
meet
here.
oxygenated demands.
Not.
The liver,
It's been a while since I ran.
no, spleen's on the left because
Okay.
the cramp. I'll never forget. I was playing soccer when I was in 3rd grade and I felt that cramp for the first time. But I gotta listen to your.
Oh yeah,
abdomen
I haven't
sounds.
ran in a while, so
Oh,
yeah.
I was like I said, it was 3rd grade when
Yeah.
I felt it. So I remember it being on the left, but also the liver is also on. Actually, no, the liver is hold on a sec. Let me just check something real quick to make sure that I'm not going to be telling you a lie. Let's see, because there's a lot of stuff. Let me see. Let me just make certain that I'm telling you what's right. Okay. Spleen and the liver, I think, are both. You know what? I tell you what. That's something that we're gonna look up later. Where is the liver? Liver, I think it's on the left.
The liver
too.
is on the left.
Yeah, I think I remember LL, liver left.
That's what
yeah.
you told me last time.
Okay, yes. Okay, thank you. Very, very good. Now, sometimes some of the organs in our body that are on the right side could be maybe like the gallbladder. It actually kind of goes all the way across. But that's just something to note as we listen and look and check for tenderness, okay? But what I'm going to do is I'm just going to start by, first I'm going to look and note the size and shape and coloration of not just the skin but the abdomen itself. And then I'm going to start by listening down low on your right side, the right lower quadrant. I'm going to listen for a couple minutes, checking for any sounds of bowel sounds at all. Once I hear enough to establish that one's active, I'm going to move up to this quadrant. If we were to draw like this and separate your stomach into 4 sections of the abdomen, we would do 1, 2, 3, 4, the right lower quadrant, right upper, and left lower. We're going to listen in this order.
I should have been fasting.
No, you don't have to.
No, I'm saying this test would have gone real quick. Because my stomach makes all kind of weird noises whenever I don't eat. And then most of the time the nurse is like, "Oh, you can tell you've been fasting." I'm like, I'm hungry. So they tell me I should start carrying like a little snack bar. And that way after I get my blood work, I can, get some on my stomach.
Mm-hmm. Okay. We've established that bowel sounds are present times all 4 quadrants.
Good.
That's very good. Okay, and stomach's a little round, but less round than it was last time. So, but I'm saying not abnormally round. It doesn't look distended. So that's your baseline, and that's the way it should be. Very good. So no issues. Okay, we already asked that. So, all right, very good. Bowel sounds present times 4 quadrants. Just jotting that down in my assessment notes. Okay, very good. Now, let me see here. I believe that I've already checked all of your pulses, and let's see. Is there any other questions that you have for me today?
Pillow.
Oh, okay. We'll get on the computer and I will help you find a good pillow for you that will make sure that your neck.
Yeah.
Yeah, so your spine looks good. So it's obviously just your neck, probably sleeping wrong and need a good firm pillow. So we'll get some recommendations before your next appointment. Okay? But thank you so much, Mr. Morris.
Kiddo.
Very, very good to see you again, and I look forward to your next assessment as well.
Do I need to tell them anything? Or?
No. I will go get this put in your chart, and I will send the tech back with my recommendations on the pillows.
All right.
Okay, that sounds great. Thank you so much, sir.